now, instead of, taking responsibility for what has happened, whether they caused it or not, and instead of, doing the right thing and acknowledging that this was a horrible situation all around, I now get the pleasure of telling you that this family, along with their lawyers, have decided that they will sue the hospital and the hospital staff for wrongful death. That's what they've decided to do. Okay? So we're going to read through their lawsuit. They have said that based on the hospital's negligence, the baby died. Okay? Now, my husband was like, well, I don't think this will have much legs, because I explained to him, what they were suing for, and I kind of went through it with him. He's like, he gets to be my sounding board to see if I should talk about things on stream and in a video, because I need to know how much the general public would be interested in hearing about it. And he's like, well, the way you've described it, it doesn't sound like it will have much legs. They'll just drop the case or whatever. And I was like, even in that situation, being named in a lawsuit as a medical doctor, as a hospital staff, a nurse, anybody, and they're probably all individually named in the lawsuit, takes up a huge amount of your physical time as well as your mental capacity. And these can drag on for years, particularly in the case of something like this, where it includes a wrongful death accusation. You have to spend time with lawyers. It's expensive. You are meeting with the hospital. You're meeting with the attorneys. You're getting deposed. This is an immensely time-consuming process that's also extremely stressful, because you're at risk of losing, if they are successful in this, potentially your job, your license maybe. Who knows what the result would be. And the fact that they've chosen to go this route despite such clear indications in that body cam footage that this could have been avoided if there was a better situation at home, just really pisses me off. So I'm going to pull up the actual filing, if you'll give me just a minute. Yeah, I, Sumner, think that there is absolutely no chance that they will win this. Quite honestly, I think they're trying to set up a defense, and I don't think they're going to be very successful in getting this actually proven. But there's a no winning in this situation for the medical staff, because even if the charges get dropped, which they will, I think that they will, or the allegations get dismissed, that I just think it doesn't matter, because the hospital staff is still having to put this time and energy into it. Okay, so I am spending way more time on this than I planned to, but that's okay. All right, so this was her arrest warrant. So she did end up getting arrested. And let's see. So this is just the story, and then I guess that's her arrest warrant. And the video footage of, we're so far into this. Gosh, why don't we just watch the footage from that too? I've obviously watched all of this, and it's just, I got real caught up in it, but let's watch this. It says, I think this is another interesting insight into her mother's dynamic with her.
I will bring her out. Just tell me what's going on.
For her arrest.
Okay.
I will give it to her whenever
Can I see
she can see the warrant when she gets arrested.
it? This is my house. I
Right.
have a right to see the warrant.
I'm letting you know she has a warrant for her arrest. We don't have a search warrant for you.
No, ma'am, you don't have a right to see the warrant. You are either harboring a fugitive or you're not. Make your choice.
How else do we have a warrant for her arrest?
Okay, can we see the warrant?
She's 19.
She gets a copy of it.
Can I go up there when you take her up there?
You can go to the detention. Do you know where it is?
Everything?
It's
Okay, so what is she under arrest for?
She's over 18. She's got a
Like, one, duh. What do you think she's under arrest for? And two, mind your business. Is she here or not? So irritating.
That.
Right.
Detective Gonzalez.
Right.
What is she under arrest for?
She is warrant for arrest. Okay?
For what?
That's all I'm going to tell you. Okay?
What do you mean that's all you're going to tell me?
She's over the age of 18.
I understand that, but I have a right to know as well.
And we'll tell you that. But
Okay, then let me know now. Let me know now. I'm giving you the cooperation. I told you answer my question. What is she under arrest for?
She is so irritating to me. I'm so annoyed.
That's not, that we can't really put that information, but bring her out here, we'll tell
What is she under arrest
Bring her out here,
for?
we'll tell you right in front of
No, I'm not bringing her out here yet. Let me know what she's under
she's
arrest
No, I'd rather harbor a fugitive, thanks.
you. Get arrested regardless. I mean, I don't know why.
for. What? For what? For what?
Are you okay with telling me?
Yeah, go ahead.
Tell me.
Homicide. Open count of homicide. And tampering with evidence.
Tampering with evidence
Yes.
at the hospital?
Yes.
So, can we see her now?
Yeah, hiding evidence would be considered tampering.
Give me a minute.
Okay.
I wish they would have arrested her for obstruction.
I have a right to see a warrant. It doesn't matter if she's over the age of 18. This is my house. You have a right. You have to show me that warrant.
Your house is not under
Even if
arrest,
she's
ma'am.
under arrest. You have to show me the
It's
warrant.
up to her to show us.
Sarah, this is Rodriguez. Trevizo. Hey, I have the detectives here. They want to arrest my daughter. They're saying they have a warrant.
God.
But they can't show me a warrant for her arrest right now. Yeah.
Oh, no. Might not be a nosy neighbor.
Like, I'm not a expert in law, obviously, but I think the only person who has a right to see the warrant is a person who is being arrested. I would even imagine that showing a warrant for someone else's arrest who is not a person that you have guardianship over and who is not you would actually probably be more illegal than not showing someone demanding to see it, because, ma'am, it doesn't have anything to do with you. It's so bizarre that she is so sure she has a right, and it just makes me feel like maybe there was quite a bit of, like, in this family dynamic, this mother kind of feeling like she had ownership over the person that is her child. You know, I think that we see this a lot in parents of thinking they have a right to decide things for their kids, and you do to some extent, but, like, it even comes down to the, like, having sex thing. Like, ma'am, you have a 19-year-old, and it's a very normal thing that at some point people become sexually active, and if that isn't what you had decided would be the case for your kid, well, I'm sorry, but, like, they now are making their decisions for themselves, and, like, you can be disappointed in that, but it's like, it's baffling to me to see people who think that they own their children. It's so unusual to me.
Could you please let me know?
That is his policy.
I will give it to you. Please don't. Please don't.
He ran away from 1002 West
Yeah,
Washington.
it's nothing personal. It really isn't. And we understand. But we have to do our jobs too, okay?
I understand that. I understand that.
Who's this?
I'm gonna go forward
That's
some.
really.
No one saw her enter the house. No one saw her enter the house today. Exactly.
Hi. What's your name?
Alexee.
Okay. What's the last 4 of your social?
She don't even know it.
You don't know it?
I don't know. I don't remember.
Alexee, do you know your date of
Absolutely,
birth?
cat.
Okay.
For sure. There is no question in my mind that mother's
Do
behavior.
you have to walk her
played a huge part in how this ended up.
It's up to you.
Yeah,
That's all. Just please.
I'll go get it.
Alexee, are you okay with your mom getting your parole complaint when we get to the detention center? It has your personal information on it. Are you okay with your mother getting the parole complaint? It has your personal identifying information on it. Serial number, date of birth.
Yes.
Are you okay?
Yes.
Okay. I have to serve you first, then your mom can get it, okay?
The irony of them like saying like as long as she's fine with it, we'll give her whatever information. Like literally all she had to do was bring the kid to the door and ask them.
I do. He's gonna move his unit around. No medications, anything you need to take while you're in there.
No, sir, no.
Okay.
She has still been like bleeding, so I don't know if she needs.
Do you have any? They do. I don't know if they have tampons.
They do have family products.
Okay.
But I'm pretty sure if you take your
God bless that male police officer. Yes, there are period products in jail.
Can she? Do you want to grab some? Can she grab some of that right quick?
But also no tampons while you're postpartum.
Get your little bag.
one of us goes with
Go ahead. Go ahead. Go ahead.
Just making sure you're doing.
Just grab it a little.
Okay. And
People
it's
do in fact
nothing
have
sharp,
periods
no
in jail.
flashballs,
I know,
nothing
it's
sharp,
wild.
okay?
Okay, one
we're
second.
gonna-
This is completely unrelated. I have to tell you because I can hear it. It is freaking snowing and hailing at my house. It is summer. It is summer here. What the hell, New Zealand? I don't know if y'all can hear that, but it's ridiculous and I'm pissed. Thank you for listening. I very much appreciate that. It is supposed to be summer. Ah,
Check it when you get over there, okay?
you can hear it. Oh, even better. Actually, sorry that you can hear that.
Confirm that address is 611 North 1st Street. 611 North 1st.
I'll mute my...
Okay, we'll check those when same thing, okay? We're gonna check all that when you get over there, okay? Thank you.
I'm going up there right now too. Okay.
All right. What's in there?
Personal pads.
Personal pads?
Yeah, she needs them.
Follow me.
3300 West Main Street, the Public Safety Complex. If you just go through the front door, you know where we first spoke in the records?
Yeah.
If you just go over there. Is there any four?
Yeah.
Okay.
I'll meet her in the front.
Okay. I'll get with him and do all stuff, go to dispatch.
Okay. I'll meet you in the front. Okay.
We're Tampa. I'll be headed your way shortly.
4, relay the rest.
I'll be headed your way for the relay shortly. Yeah, I was gonna go station. He signs the original, then I'll relay, send it back.
Make sure you send a copy of the readout so that
No, that's what I'm gonna relay it.
you can send them a copy, right?
19.
Send them.
Okay, so that is the arrest body cam footage, which I just think gives a little bit more insight into kind of the state of mind that her mother was in, and maybe a bit more insight into the dynamics that were going on in their house that potentially contributed to what happened eventually. All right, so let's go through what this says. So, wrongful death, personal representative of the estate of Alex Ray Fierro. That is, I guess, what they named the baby. The defendant is the hospital and the staff at the hospital. It's not immediately clear to me if they've named the staff, defendant, doctor. Would that be? Yeah, so they have named the doctor. I don't see a name in here, but I'm assuming that it would be included somewhere. I'm just looking at the chat for a second. Yes. Okay. Let me find the actual part that we're interested in. Factual background. Okay. On January 26, 2023, Alexee Trevizo, hereinafter Alexee, the surviving mother of the decedent, attended Teresa High School as a student, was on the cheer squad, and attended cheer practice on January 26th. That evening at 11:47 p.m., Alexee was taken to the emergency room complaining of low back and abdominal pain. That's the first footage that we watched just a second ago. At the emergency department, the pain level that Alexee stated she was in was 10. Alexee is a female of childbearing age. Alexee had regular menses, had used birth control pills and condoms, worked out a minimum of 2 hours, 5 days per week, and had worked out on the 26th of January for 3 hours. At approximately 12:05 a.m., Alexee was seen in the emergency department, at which time the attending physician was Heather Marshall Vasquez. Okay, y'all just send... I can't imagine just like being a doctor, doing my job. You know, like there are some times where getting sued for things that happen at your work is understandable, but this is just, it so pisses me off. So yeah, they did actually name all the physicians, not just the hospital. So let's review that timeline. So 11:47, she shows up. She's being seen by 12:05. Okay, that is a freaking rapid response time for an emergency room. Upon exam, she said she had low back pain. The doctor said that she had been at cheerleading practice, or she told the doctor that she'd been at cheerleading practice, felt like she needed to have a bowel movement, but was unable to do so. Alexee denied pregnancy and informed the doctor that she was on her period. Alexee was asked if she had had a pelvic exam before and said that she had not. At 12:18, so she's now been in the hospital for 30 minutes and has been in the emergency room being seen for 13 minutes. They gave cyclobenzaprine and acetaminophen. That's Tylenol and I think Flexeril. I'll have to see if that's... I think that's called Flexeril in the US, but let me check. Yeah, Flexeril. So that's a muscle relaxant. Tylenol, Flexeril, both things we use all the time in pregnancy. At 12:28, so 10 minutes later, she was given sodium chloride. This is just IV fluids. She was given ketorolac. This is Toradol. Although we generally recommend against using NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, Motrin, etc. in pregnancy. And this Toradol is that. A single dose of Toradol, particularly during delivery, is not going to cause a problem. The problem with ibuprofen or anything like that is going to be long-term use. And although we still try to avoid it, there's nothing immediately toxic about this medication that would be a problem. Like if someone was accidentally given it while they were in labor, I would be like, it'll be fine. It's no big deal. Ondansetron, that is Zofran. We regularly use that all the time in pregnancy, particularly if you are nauseous during labor. And morphine, also used all the time in pregnancy. I mean, we try to avoid using opiates because they certainly can cause some problems like with respiratory depression. And that might be where I see, this come into play in this lawsuit. But that's the only one that I can even say maybe had a tiny bit of concern here, right? But they adamantly said that there was no way that she was pregnant. Okay, so morphine is not going to be immediately toxic to a developing baby like a single dose of morphine at some point. Let me finish. We'll go through this and then I'll talk a little bit more about the morphine, okay? All right, so a saline lock in your analysis was completed. No specimen was received of HCG qualitative serum. So this 22 is saying like they put an IV in and then they saline locked it so that if they needed to give medications or draw blood through it, they could. They did a urinalysis to look if she had like a UTI or something, but that they didn't send a blood specimen for a pregnancy test, which I don't think there's any reason that they needed to do that. They can do a urine dip pregnancy test, and they already had a urine sample. At 12:28, lab tests were ordered and entered. At 12:28, a serum pregnancy test was ordered. It was then collected at 12:30, reported out at 12:51 by the call out showing a positive result. Okay, so I don't know if they ordered a urine pregnancy test or not. Either one would be fine. So they knew, but within an hour of her arriving, that she was pregnant, despite the fact that she adamantly denied any chances of that. The medications which were being given via IV, cyclobenzaprine, acetaminophen, sodium chloride, ketorolac, ondansetron, and morphine, and despite AGH, I don't know what AGH is. Did anyone catch what AGH is supposed to mean? Doctor and nurses, knowing at 12:51 Alexee was pregnant, continued after they had notice of the pregnancy. Okay, cyclobenzaprine, acetaminophen, sodium chloride, which is literally just normal saline. Like, why they included that is so bizarre. Toradol, ondansetron, morphine. All of these, particularly if she was like 15 weeks or something, are like a couple of doses are not going to cause a problem. There is no reason like it would emergently needed to have been stopped. Medication including morphine was not stopped after the defendants knew at 51 hours that she was pregnant. First off, I think that's a typo, but you're not just like continuously running any of these medications except the normal saline. So this screams, I have no idea what I'm talking about. Normal saline would be an ongoing like IV drip. Potentially. It can also be given not like that. But none of the other ones are being given continuously over this time frame. I can't remember what time she delivered in that footage, but I would be surprised if they gave another dose of any of them prior to that, because you would dose morphine maybe every hour. This is just bizarre to me. All right, so here the other window is better. Ketorolac, ondansetron, cyclobenzaprine, another typo. Come on, this is bad. And morphine all have warnings regarding use if the patient is pregnant. I'm not going to bother all of you by looking those up. Ketorolac, you don't want to use it continuously in pregnancy, but there are times when I would use it. If somebody has a generating fibroid, I might use it. There is, like you're not going to cause harm to a fetus with a single dose of ketorolac. Ondansetron is regularly used all the time in pregnancy. There are some concerns with cleft palate if given very early in the pregnancy, but even that data is really, it's questionable. So that's silly. Cyclobenzaprine, regularly used in pregnancy. And morphine, regularly used in pregnancy for people who are having acute pain problems and even sometimes in the process of labor. Yeah. Having warnings while you're pregnant doesn't mean like is going to immediately cause death to a baby. That's bizarre. Sorry, I'm ranting. We're never going to get through anything else. And Karen will kill me because she worked very hard on our PowerPoint. So she said she needed to go to the bathroom. A nurse removed the IV at 1:40. Remove the IV. That's not even correct either. I'm sure what they did was just HEP lock the IV, so they probably stopped the normal saline drip so that she didn't have to take the IV pole with her to the bathroom. Surely they didn't take it out. Alexee's mother checked on her after 1 minute. That's impressive. So she goes to the bathroom at 1:39, and at 1:40 her mother checks on her. I feel like this is either wrong or her mom, you know, it wouldn't shock me. She is a bit overbearing, it seems. Checked on her again at 1:49. At 1:56, AGH is the name of the hospital. They checked on her, and the nurses got the key to unlock the bathroom door, but before it was unlocked, she left the bathroom. No one assisted her as she walked back out and went back to the room. She gave birth unassisted to a son in the bathroom. At 2:02, doctor had already ordered an ultrasound to determine the status of the baby, and the same was ordered before the doctors and nurses learned she had given birth. They pronounced the baby dead at 2:38 a.m. Hospital allowed police into the room of Alexee with lapel cameras on, asked questions of Alexee and her mother that are protected by HIPAA laws and by the New Mexico Constitution laws. All right, listen. All right. HIPAA has nothing to do with this, okay? Police are not bound by HIPAA. This is the dumbest thing I have ever read. Like, not only from the fact that the medical facts are all off, but if somebody who wasn't medical read this, they'd be like, yeah, I get it. It's like, I can see how that would not be okay. But like, HIPAA is Health Information Protection Privacy Act, and it is for people who work in healthcare, not police with body cam footage on. Where are we? Subsequently, the videos without consent of Alexee, her attorneys, and or the court were disclosed to the media. All right, listen. I don't freaking care. Okay, this is a lawsuit against the hospital and the doctors and the nurses and the other medical staff there. So why are we talking about things that you think the police did wrong? Cry me a river. Sue the police. I don't think you'll get far because... but it's irrelevant. Irrelevant! Objection, Your Honor. Irrelevant information. The hospital violated HIPAA laws by allowing the taking of such videos and the release of protected health information. The hospital is not in charge of what the police do. Sorry. And also, they're not in charge of that being released to the media. The hospital employees and doctors were aware of the pregnancy at 12:51 and failed to inform Alexee that she was pregnant, failed to take the necessary healthcare precautions and protocols for a pregnant woman who was at a term pregnancy. 1, they didn't know it was a term pregnancy because someone said there's no way they're pregnant. 2, you are not required to immediately run to the room and give information to a patient as soon as something is resulted in your computer system. This is so dumb. The decedent died from the malpractice of the defendants. Sorry, I need a minute. You guys can sit here with this. I'm going to let some air into this very hot room and turn off my heater and sit with that for a second because it pisses me off, okay? Not number 42. Mm-mm. Okay? I'm so mad. I'm like, So, again, before I read this and before this happened, Before I read this, and even, yeah, they got ChatGPT to write it. Yeah, I actually think ChatGPT wouldn't be making spelling mistakes and such silly statements. Honestly, I think ChatGPT could have done a better job. Sorry, very distracted at the moment. Okay, so anyway, being aware of the pregnancy at 12:51 a.m. and failing to inform Alexee that she was pregnant prior to her leaving and delivering the baby at 39, less than an hour after that. Like, this is an emergency room. This is a Wendy's. There are potentially people like actively dying, right? So if you have a pregnancy test in somebody who has said, there's no way I'm pregnant, and you have this complex social dynamic going on between the teenager and the parent that's at the bedside, that they've given permission to be at the bedside, so you can't really just kick them out without them saying that that's okay, then, okay, like, if there's maybe a trauma in trauma 1, someone had a car accident and they're bleeding out, you're not going to run to the socially complex room to talk about that. They're emergency room doctors. They're treating emergencies. And obviously this is an emergency, but they did not know she was term pregnant because she chose to withhold that information. It's so stupid. Again, I have a lot of empathy for the things that led up to this point, but thinking that it's appropriate to do this is ridiculous. So she was 19 at the time, 5 foot in height, and her weight was 126 pounds. Literally don't care. All previous paragraphs are incorporated as reference. Defendant hospital breached its duties by. All right, 1 second. Oh yeah, okay, my kids are home, but that's all right. We'll finish up for a while. It's okay. Okay, so this is how the hospital apparently breached their duties, all right? 1, failure to perform a timely, complete, and accurate assessment of Alexee. I'm sorry, but we cannot work with information that we are not given, okay? If she had said, I am full-term pregnant, then this probably would have gone different. If she really didn't know that, which I don't believe, then even in that case, there's no way that you would say that arriving there and being seen at 12:05 and not knowing about the pregnancy until 1:40 or telling them until then is like malpractice. There was no reason to think that something immediately life-threatening was happening. Part of medicine is just gathering information. This is so stupid. And it just makes me so mad. Failure to follow guidelines and practices that a woman of childbearing age complaining of low back pain and or abdominal pain is presumed pregnant until proven otherwise. Please tell me again how ER doctors should ignore the pain of people who are reproductive age because they might be pregnant. Like, what are we doing? Of course that's not what you should do. You can give pain medication to people even if they have the ability to become pregnant because they are people in pain who deserve pain relief. This is insanity. I'm so mad. So yeah, someone said this has got to be a dude writing this. Failure to follow guidelines and practices that a woman of childbearing age who indicates she has to go to the bathroom should be examined first to make certain she is not pregnant and giving birth. There you have it. These lawyers think that before you're allowed to poop in a hospital toilet, if you present with, I don't know, possibly like food poisoning or something causing severe abdominal pain, that you should have to have a pelvic exam before you're allowed to poop. That sounds like just incredible advice. I love it when attorneys go to medical school and learn such important things that were left out of my medical training, actually. I actually applaud this attorney for having so much really beneficial information that I never knew I was malpracticing all the time. I mean, I see people who can get pregnant every day, and never have I once ever, unless they were in active labor and I knew that because they told me that they were pregnant, never have I once ever said, I'm not going to let you poop. I have to do a pelvic exam first because, yeah, you're 21 or 14 or 15 or 35, pelvic exams before pooping. It's the new rule. I'm really just so incredibly thankful for these attorneys because I could have just medical malpracticed my whole life. Now, luckily, they've saved me for that. Okay, moving on, because I obviously can't stop being ridiculous. Sorry, I'm so distracted. Failure to follow guidelines and practices that a woman known by the hospital doctor and caregivers to be pregnant based on a hospital and doctor test should be examined before going to the bathroom, especially after muscle relaxants and morphine have been given via an IV. Make certain she's not giving birth as opposed to having to relieve themselves. One, do we even know that the person who had seen the test result actually was who she said she was going to, I don't know that that was even the same person. Like, who knew about the test result at this point? And also, where is this girl's responsibility in all of this? I'm not going to force people to have an exam before they go poop. Failure to document accurate, factual, and complete information in the patient's permanent medical record regarding nursing care rendered. Okay, I don't know. I haven't seen the records. Can't comment on that. Failure to develop and implement an appropriate nursing plan of care for a 19-year-old female patient in the emergency department complaining of low back pain, abdominal pain, and necessity of going to the bathroom. All right, so this is a particularly sinister point for me because they're not just suing the doctor or the hospital. This Section F is specifically saying that they also think that the nurses are responsible, and they are suing the nurses particularly because nursing plan of care is a nursing, obviously, thing. And so there are lots of lawsuits which nurses don't get dragged into, and of all of them, this is, I mean, I don't think any of the medical staff should have been dragged into this, but certainly the nurses shouldn't have been dragged into this. Who knows if they even knew the test result, but also they're not responsible for figuring out what's going on. I don't think any of the people in this should have been sued. It's ridiculous. But I can see the doctors, again, I do not think that they did anything wrong, but I can see the doctors being included before the nurses. Like, are you freaking kidding me? The nurses didn't know what was going on, and it's not their job to figure out exactly what's going on. That's the doctor's job. This is all so ridiculous. Failure to provide standard nursing interventions to prevent administration of medication or contraindicated medication to be administered to patients prior to an appropriate differential diagnosis. One, how do you know they didn't have an appropriate differential diagnosis? And two, none of those medicines are absolutely contraindicated in pregnancy. Thank you, I am an obstetrician. Failure to develop and implement an appropriate nursing plan of care for the person reporting with symptoms that Alexee had. Failure to have at the top of the list the possibility of pregnancy. I am 100% completely certain that at their top of their list of differentials was a possibility of pregnancy, which is particularly why they did a pregnancy test. That would indicate to me it was on the differential. Oh my God, I should never be allowed to read stuff like this. I'm so stressed. I hate it. It makes me so mad. Okay, and I'm getting hot. I gotta open the door again. I hope it doesn't get too loud. Okay, I just pulled the curtain back and left the door open, so it might change my lighting, but it'll be fine. Okay. Can we get back to this personal torture that I've decided to bring upon myself? Let's see. Nurse failure. Okay, yeah, here we are. Failure to hire medical providers who are qualified and adequately trained regarding the diagnosis of pregnancy. You're right. Nobody in that hospital was trained to diagnose a pregnancy. Are you fucking kidding me? Alexee could have diagnosed a pregnancy. She's even trained for that. It's called the pregnancy test is positive. Failure to hire medical providers who are qualified and adequately trained regarding the necessity for performance of pelvic exams and delivering babies. What the fuck are we even doing? I'm sorry. This is so dumb. I have never read such stupid claims in my life. Failure to have available necessary equipment to properly evaluate a woman of childbearing years to determine pregnancy and whether birth is imminent. Yeah, well, turns out most of the time if birth is imminent, people will say something like, I think something's coming out. You've all been on YouTube with me when we watched Didn't Know I Was Pregnant, right? They don't typically run to the bathroom and lock themselves in by themselves. They typically say, something's coming out. Oh my God, I think I'm dying. Can you help me? Maybe we shouldn't have concealed our pregnancy. Okay, continuing. Failure to implement and operate a medical record system to communicate patient status to the attending physician in a timely and proper manner. Okay, y'all correct me if I'm wrong, because I may be just real stupid at reading these. Are they saying both that they had the information and didn't act on it because they are idiots and the hospital should hire people that are less idiot than the idiots that they employ? And also saying, like, the stupid hospital didn't tell the attending physician what was going on, and they should have. Both those things can't be true. The doctors can't be idiots who failed to act in a timely manner on the information they had, while also not being privy to the information because the hospital systems suck. What are we saying? There's a lot of words here. So many words, and none of them make sense when put together. Failure to implement and operate a system in which the existence of pregnancy is immediately provided to the attending physician. That is not necessary. Sorry, it's not. Failure to implement and operate a system in which the attending physician and nurses communicate timely and proper manner with the patient. What is the timely manner to, in an emergency department, divulge what is seemingly non-emergent information until it is emergent information, and, you know, there's some patient responsibility that goes into, you know, giving accurate information about yourself and what you have going on. Regardless, what is the timely time frame of that? Is it like you should be addressing this, what will honestly just be a very complex social situation in the best of cases, and then with a mother acting like that, you know, is going to be ridiculous long discussion where people yell and scream and fight. So if that's going to be the case and you already know that, and there's other emergencies going on, like, what is the timely fashion? I don't think that that's the case. Anyway, failure to implement and operate a system that requires written consent prior to sharing a patient's healthcare information. The patient shared her information, so I think when a dead baby is in a trash can, that we are allowed to tell the police, hi, we found a dead baby in the trash can. And the police are allowed to come in and ask questions. I don't know. I guess I can see a little bit of this claim like around, I don't know. This is complex because earlier when they were talking about the body cam footage, they were talking about Alexee being filmed and she was answering questions and stuff. But once you have a criminal possibility going on and you've got a dead baby in a trash can, I don't really think that, I don't know. I don't know. I think that the staff is allowed to communicate with police about that. I don't know. But regardless, this is all ridiculous. If HIPAA actually does prevent you from talking to the police in a case where there's a dead baby in a trash can, then I am in favor of changing HIPAA laws to not be like that. But I don't know if that's the case or not. Failure to implement and operate a system that prevents the release of HIPAA-protected information outside the hospital and those directly providing care to the patient. I mean, the hospital and the doctors, they didn't do that. They didn't release any information to anybody. The doctors didn't talk to the media. They weren't interviewed by the media. They spoke to the police about a suspicious death of a baby in a trash can and the events leading up to that. And the police released the body cam footage. I don't know. This is so silly. By other means, it will be ascertained through discovery during this litigation. Oh yeah, and also everything else that they did wrong. You know, all the other things that all these idiots did. Treatment, care, and management of Alexee in the hospital were wanton, reckless, and performed with utter disregard for the safety and welfare of Alex Ray Fierro. The death was direct and proximate result of the negligent acts and omissions of defendant hospital doctor and healthcare providers of the defendant hospital. I'm sorry, what? Maybe if she had said, oh my gosh, help, I delivered a baby, they could have helped. It's like, what the heck? I just don't understand how they could pretend that nothing that happened in the 20 minutes she was in that bathroom has any bearing on the outcome. Or anything that happened in the 35 weeks before she walked into that emergency room and the way that she was raised and all of that. Like, this is insane. All right, so the defendant hospital knew or should have known that hiring and or credentialing the doctors, nurses, and staff who cared for Alexee would create an unreasonable risk of injury to a group or class that includes the decedent. Defendant hospital failed to use ordinary care in hiring and or credentialing the doctors, nurses, and staff who cared for Alexee. What an offensive, horrible, insane allegation to make. It makes me so mad. I am so mad. I am so freaking mad. After they've had to go through this, okay, this is a traumatic experience for everybody involved, not the least of which is Alexee herself, because again, I do have some empathy, in a little box, which is now, covered in layers of anger for what led her to do this. I don't think that absolves her of responsibility for whatever happened in that bathroom and before, but to then traumatize everybody around you and also then just drag them through this is insanity. Her mother should be in jail. Okay. So they hired shitty doctors. They don't understand how to treat pregnancy. They don't know how to deliver a baby. I mean, I don't really know how to deliver a baby. I didn't know was in there either. Nobody taught me that, because usually that's something that people tell us. And if they don't know, it's usually something they tell us immediately after the baby came out. Inappropriately trained healthcare providers. They don't know what pregnancy is. They don't know how to define or recognize pregnancy. They have bad procedures. They don't have any guidelines. This attorney doesn't know what HIPAA is. Choosing not to establish and enforce adequate written procedures. Okay, blah, 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 blah. I can't read any more of this. So, all right, let's read that. This is interesting to me because we know definitively that I am properly trained to take care of pregnant patients, right? So this says if they had been properly trained and supervised, then they would not have, among other things, negligently failed to provide adequate nursing interventions to prevent the death of Alex Ray Fierro. I don't agree with that. Negligently failed to provide adequate nursing interventions to... Did that just say the same thing twice? Does this say the same thing twice? This is so bad. Did this attorney just have a few beers and write this in 3 hours one night and never proofread it or have, anybody else on his team go through it? What the hell? This is insane. How about you are a negligent attorney and whoever you work for failed to make sure that you were appropriately trained in, spelling, grammar, and the writing of legislative lawsuits or whatever this is. Negligently failed to provide adequate medical services to prevent medication, over-medication, or contraindicated medication for a pregnant female. We're still going to talk about that in just a second. Timely testing, more stupid things, more things they don't understand, more wildly irresponsible accusations, more silly talk about hiring because, we should trust the judgment of the attorney that wrote this incredible piece of literature. Okay, yeah, that's enough. I can't do it anymore. I can't do it anymore. Okay, I'm gonna go shut the door because now I'm getting cold and I just can't temperature regulate out here. I will talk about the discussion of the medications, okay? So in the process of labor, all of those medications that they listed, so sodium chloride for sure did not cause a problem. Ondansetron or Zofran absolutely did not cause a problem with the baby. Toradol, a single dose soon right before delivery, is not going to cause the death of a baby. Morphine, cyclobenzaprine also is not going to cause death of the baby. We use that regularly in patients who are pregnant. The morphine we can talk about. So morphine is an opiate medication, and we do use it in pregnancy, particularly if someone's having severe pain and they're not close to delivery. You don't really want to intentionally give it right before delivery because it can cause neonatal respiratory depression. However, that is a very treatable thing that can happen. So most of you probably have heard of naloxone, which is an opiate reversal, right? And you've probably heard of it in relationship to discussing fentanyl overdose. But naloxone can also be given if somebody receives an IV opiate medication like fentanyl or morphine and then rapidly delivers soon after, and the baby is having respiratory depression, meaning it's not breathing as well as it should be. It causes respiratory depression in adults too, but that's how opiate death can happen, but it's a smaller dose in a baby, obviously. So if that was the cause of death. And again, I don't know what the cause of death here is. I don't know if this was a stillbirth. I do not know if this was an intentional killing of that baby. I don't know what happened in the bathroom, and I'm going to give you a couple of my theories. But if what happened was the baby was alive but not having a respiratory effort, then if she had asked for help, easily available in that trauma unit, they're in an emergency room, would have been naloxone. And if respiratory depression had been there because the morphine was given close to the time of delivery, they would have given the baby naloxone if they had known that the baby was born. So the negligence was not on the staff for treating the person who was pregnant for their pain. That is something that I think ethically you should do. The negligence here would be on the person who delivered a baby. And let's imagine that the scenario was the only problem was that he was respiratory depressed from the opiate medication. They could have fixed that and they could have kept him from dying. They couldn't do that because she was negligent and did not alert the hospital staff as to what happened. So out of all of these things that they talk about, morphine is the only one that I could even see playing a role at all in the outcome here. And it only played a role because she was not forthcoming with information and she did not ask for help once that happened. My theory on this is actually not that the morphine caused the problem, because it had been probably an hour since she got the morphine, judging by the timeline, although they could have given her a second dose. And I suspect because she was a relatively small person who doesn't have a history of needing extra opiates to control their pain, I would guess that they had not given like a hefty dose of morphine, and the chances of that causing respiratory depression in the neonate that was born an hour later is, I think, fairly low. Not impossible, just a theory, you know. My theory, based on listening to them describe what the room looked like and what the umbilical cord looked like, is that Alexee, whether she knew she was pregnant or not, I suspect that she did and was intentionally concealing it, but I don't know because people can be pregnant and not know. But whether she was or not, I suspect that she went in that bathroom, delivered the baby, whether she was standing or sitting, I don't know, and that the umbilical cord broke, either because she was standing and it fell to the floor, or because she was sitting and it was a short cord and it snapped at the time of delivery. That can happen. It doesn't happen often, but it absolutely can happen. If that happens, then blood goes everywhere. If you avulse an umbilical cord, meaning rip it either in half or off at the belly button, then the blood goes everywhere from the umbilical cord side and from the baby side. And when that happens, babies rapidly bleed to death because they don't have a very big blood volume. That umbilical cord was separated regardless of how it happened. I don't think that she could have just, I don't think there's any way that she could have just snapped it. That would be very weird. I mean, there's certainly sometimes umbilical cords that are really thin and maybe you could do that, but it is fairly hard to get an umbilical cord to break. So I don't know, what the story there is, but the way they described it was that it wasn't clamped with anything or tied with anything. And if that baby was alive, even if it wasn't crying, and that umbilical cord snapped either because she did it or it happened on its own, the baby would have rapidly bled out. Even in that situation, I don't know if she immediately got help, if they would have been able to intervene and save the baby. This is a very rapid process. Certainly, there was more chance, if that was what was going on, for them to intervene and save him if she said something. But I don't know necessarily if they would have been able to, because it happens very quickly. And so the other obvious thing that most people thought when they heard this is that she suffocated him. And that's certainly possible too. Or there is also the possibility that she actually thought he was stillborn and that he was put into the trash bag and suffocated there. So I would be interested to see information about the placenta, so someone said the autopsy showed the baby was born alive and died from being put in the trash bag. I'm not sure autopsies say things like that. Adrenal hemorrhage is an interesting finding. Yeah, so it doesn't say the baby died of entrapment. I will look and see if it says anything about that, but I don't know why this is blurry, but it says that the baby was found entrapped in a plastic bag. No decomposition or maceration, which means that this death happened either in the process of labor, immediately before, or immediately after. No congenital anomalies, patent foramen ovale and ductus arteriosus. Okay, this is important too, because that means that the baby had not taken breaths significantly enough to alter the way that the blood was flowing through. This is really blurry. I'm trying to read through it, even though it's blurry. But the patent foramen ovale and ductus arteriosus is something I've talked about in a video where I talked about the physiology of how blood flows in a fetus. And it's basically a hole in two parts of the heart, and it allows blood to flow a bit differently because you're not breathing in to oxygenate the lungs when you're a fetus. Once you're born and take a big breath, the change in pressure that happens in the lungs causes those to close. The foramen ovale usually fairly quickly. Ductus arteriosus maybe takes a little bit more time. But usually if babies have taken a good few breaths, that foramen ovale should be closed or closing. And so that would make me think that there wasn't a lot of breathing going on prior to the baby dying. Now, that's not one for one. It's just something to note. So they tell the story. No resuscitation was attempted. They said that in the deposition. They said that in the autopsy report. So they're going to have a hard time really saying that CPR was... I have no idea why there are balloons behind me. They're going to have a really... What is that? Why is it doing that? They're going to have a really hard time saying that CPR from medical staff caused the aeration in the lungs and stomach. Now, her defense could be that she tried to resuscitate the baby, but... It is thought that the placenta may have been flushed down the toilet. So they don't have a placenta? How could you flush a whole placenta down the toilet? Autopsy and postmortem CT showed no anatomic abnormalities or physical injuries. The lungs were aerated and there was air in the stomach and no changes of decomposition. Connections in the heart that allow proper blood flow in utero were still open, which is not unusual. The adrenal glands showed microscopic hemorrhage, which can be seen in hypoxia, lack of air. So that's problematic for trying to prove that the baby died from something else. A placenta is a full-term placenta, that would even be a fairly small one. I cannot imagine how a full-term placenta could get flushed down the toilet. That's that makes no sense to me. Let's see. Viral testing showed no viruses, no infections, maybe some contaminant. Electrolyte testing was normal. Metabolic screen was normal. Chromosomes were attempted, but inadequate for interpretation. That's weird. Postmortem toxicology showed phentermine, a derivative of amphetamine that is often used as an appetite suppressant. Interesting. She was taking fen. That is something that I did not catch in any of the other information on this. So phentermine is a prescription-only appetite suppressant diet pill. And there's not really any other medical use, to my knowledge, of why that would be prescribed to a 19-year-old who is seemingly normal in size. Yeah, so someone said, could this be something provided by the mother? I don't know. Yeah, I guess so, especially if... I don't know, guys. It's beyond me. This whole thing is weird. And it did show morphine also. So there was enough time for morphine to cross the placenta, which is not surprising. That happens almost immediately. But they don't discuss the level in which that was at. Neuropathology exam showed a normal for age brain with no pathological findings. nonspecific vascular congestion, which can be seen in hypoxia, among other things, air in the lungs and stomach, and no evidence of decomposition is consistent with the baby having been born alive. Based on length, weight, and organ size, I don't know what they've redacted here, but basically says term and compatible with life outside the uterus. Entrapment occurs when an individual is in an airtight or relatively airtight container, in this case a tied plastic trash bag, and consumes all of the available oxygen until there's no longer enough to sustain life. Given the investigative information, exam findings, cause of manner of death are best certified as, this may be where they go on to say that it was potentially entrapment, which is what someone was saying in the chat earlier, but seems like... Okay, so I don't know. I don't know that... I'm not a pathologist, but... And that may not... It's obviously not the full, complete report, but I find it really odd that they didn't talk about the umbilical cord, because there is still an umbilical cord. If they don't have the placenta, which is weird, or maybe the placenta went with her, like, because my understanding is they said that she hadn't delivered the placenta, and that's why they were transferring to another hospital. But regardless, if that's the case, like if she went to another hospital with the placenta still in her, this is a very bad autopsy report. Like, that is concerning to me that wasn't noted. And that they said like, oh, well, you know, we heard that it was flushed down the toilet, which is weird. I just don't think that there's any way that would happen. I'm still trying to work through my feelings and thoughts on this. Okay, and then they don't comment on the state of the umbilical cord at the belly button. Just like, you can't just snap an umbilical cord and a baby not bleed out. That's just not how it works. Like, I would like to see, like, what was the vascular status of the baby? Like, what was the blood volume in him? Because it just doesn't make sense to me. You can't break an umbilical cord that quick after birth. Like, if you leave it attached long enough, then it will happen that it clots off on its own and it's fine. But you can't immediately after birth have an umbilical cord snap or be cut without being tied off or clamped and not have a baby bleed out. That it's just like, that's what happens physiologically. That is what happens. And in my head, I'm questioning the validity and how much I trust an autopsy report. I'm hoping that there's just a lot more of it that I didn't get to see that does not make a comment on the fact that the umbilical cord was broken and like talk about blood volume and stuff like that at the time of the autopsy. It's very, very weird. I'm not real happy. If this was the autopsy report I was given as an obstetrician, even in a case where I wasn't worried about whatever they're worried about here, I would be a bit frustrated, and I would be calling the pathologist to say like, hey, can you clarify what happened with the cord and how much blood was like in the heart when you did the autopsy. Yeah, bleeding out makes the most sense to me too. Now, I just can't imagine how there would be time for the baby to suffocate if it had no umbilical cord attached. It just, unless the umbilical cord was still attached when the suffocation happened, that'd be the only way. And then it was broken after that, because then you wouldn't have that as a problem. But the way they describe the blood splatter and the umbilical cord, something's not adding up to me. I will be very, very interested to see what the outcome is for this when it goes to trial.